We will resume the debate, the matter of public importance. Member for Karama.
Thank you, Madam Speaker. And before I start, I would also the Grant Tamling. I think he was a fantastic champion of the Territory, and if we can follow in those footsteps, we'll be doing very well. But let me now go back to the matter of public importance. And the title was that the NT government ensures its investment in healthcare meets current and projected future needs of all Territorians. Well, Madam Speaker, I think I speak on behalf of the whole Assembly, when I think we have a number of things in common here. I believe we all want to have a first-class health system to serve all Territorians. I believe we all want to have well-staffed hospitals and healthcare facilities. I believe we would all want the Territory to be a place where health professionals want to come here to work and live rather than leave. And I believe we would all want to have short waiting times, and noting that my son's a paramedic, reduce the need for ramping services to support our health service. So I think we all have the same aspiration. Unfortunately, this is not the system we inherited when we came to government. We actually inherited a broken system, and I think the Minister for Health alluded to many of those issues. But let me go back. And as members wouldn't be surprised, and I'm sure the opposition's not surprised, I take them back to our plan here, because we said we were going to restore our lifestyle. And part of that was access to health care when you need it. Access to health care when you need it, because we can't get it. And there are a couple of elements to this plan, and I'll just touch on them, and others have already spoken in detail, including the Minister for Health. We will fix the broken hospital system. We will stop Labor's endless code yellows by relieving the pressure on hospital emergency departments. We will tackle alcohol-related harm that is increasingly rising in emergency wards with stronger laws and rehabilitation. And that includes laws against those who assault workers, including health workers. We will work with the federal government to increase aged care facilities to help free up hospital beds. And I'm sure as part of all the federal elections coming up, our government will be making representation to our federal counterparts. This will also improve the wait times for Territorians on much-needed surgeries. Another element, better access to cheaper medicines. Families will get easier access to cheaper medicines and vaccines, and we've seen what we've already done with meningococcal and others. This will save time and money for families and take pressure off GP waiting rooms. And then we have disability services, and I know the Minister is looking forward and working towards improving access to a greater range of disability services and additional needs schooling. So that was just what we went out publicly. We recognised that the system was broke. And I guess one of the things we really need to do is understand, how can we fix it? How can we fix this broken system? And a key element of fixing the broken system is we've got to be able to fund it. Fund it. Because Labor made lots and lots of promises, but they didn't fund it. And that's just not right, Madam Speaker. It doesn't work that way. And we are definitely about trying to fund it. And how? We're going to rebuild our economy. Rebuild our economy, Madam Speaker. And how are we doing that? This is something that Labor never understood. You need to actually rebuild the economy to fund our essential services, be it health, be it education, be it police. We need to get the economy going, and that is what this government is focused on. So, when we look at some of the legislation we've just recently passed, it needs to be looked in that lens of building the economy. I know people say, oh, that coordinating the legislation, we shouldn't have done it. It was all focused on getting our economy going, making it easier for the economy to grow. Our payroll tax reform, it is there to support our private sector, to let them grow. We've just had the merit review go through. That is to take out the red tape, make sure that projects, sure, there has to be the due diligence, there has to be the appropriate scrutiny, but not the overly bureaucratic third-party stuff coming in to delay projects that generally can get up and get their territory growing. And I can tell you, and I heard I think it was the member for Johnson the other day, almost sort of saying, oh, we don't really want the private sector, you know, you're too focused on the private sector. Well, I can tell you, I am an absolute champion of the private sector, and I have aspirations where they can actually really fund our budget, but we've got to let them do it. We can't hold them back. And that's where a lot of our initiatives at the moment are there to free it up so we can get our own source revenue going. We can get the gas industry going. We can get our onshore royalties going. I heard the member for Nightcliff saying, oh, IMPEX, you don't get the royalties. That is offshore. Those royalties go to the Commonwealth Government. They don't go to the Northern Territory Government. If only you'd understand these things. We've got to get our own revenue. So I just say again, I believe we all have the same aspiration. Unfortunately, Labor failed. They didn't deliver. We are committed to delivering, but we're going to do it in a funded way. We are fully committed. I'm really pleased to be the Assistant Minister for Health, and I absolutely support our government's initiative, and I do thank you for bringing on the MPI. Thank you.